Today I have with me my good friend and an absolute authority in the world of hyperbarics, Dr. Jason Saunders. Dr. Jason Saunders is the doctor of chiropractic. He is currently also involved at the PhD program at the University of Miami. He is an extremely educated guy. He owns, together with his wife, Core Therapy Family Wellness Center, several HBOT USA clinics, and also HBOT USA, which is a business that helps other practitioners to set up hyperbaric clinics, provide education, and develop business protocols. We'll start from the beginning. Jason, can you tell our listeners your love affair with hyperbarics? How did it start?
When I first got into practice, as a side project, I was renovating a house while I was, nights and weekends, while I was treating patients during the day. And I was putting a new roof on the house, and I was carrying, shingles up and down a ladder, and literally, putting the roof in by hand, by myself. And going up the ladder, I ended up blowing a disc in my lower back. And, I was able to get down. I got down off the ladder. Luckily, my wife loves me, and so she was treating me throughout this process. And at the time, my background is in chiropractic, like you said, exercise physiology. I do a lot of nutritional work. And so as far as I knew, I was doing all the right things. I was getting, manual therapies. I was eating right. I was taking natural anti-inflammatories. To me, this should have been something that, healed pretty quickly, and I should have been back in action. And as far as the back part goes, I was back treating patients within about a week and a half or 2 weeks, but I had full drop foot on my right side. So complete loss of feeling and motor function in my right foot and my right ankle. And this persisted for months. And I kept trying new things, kept trying different things to no avail. And I started to just think that, maybe there's either I'm missing something, or this is my life. And it was about a year and a half later that I went to a conference, and in the vendor hall, they had, all kinds of different modalities. And I'm always looking to learn something new. And they had these chambers. I had no idea what it was at the time, but they had these chambers and they were doing demos, and it looked interesting to me. So I started talking to the guy. I asked him if I can go in. So I went in. I was reading a book, like he gave me a book to read while I was in there. So I was reading a little information about it. I was there for about a half hour. I got out and I just kept walking around the vendor hall. I didn't think much about it. And all of a sudden I got like pins and needles in my foot. I hadn't felt my foot in about 18 months at that point. And I'm like, wow, I wonder if what I'm feeling in my foot has something to do with that thing I just did, whatever that was. So I go back over to the guy and I ask him, and of course he says, "Oh yeah, of course, yeah, that's exactly what this does, Mm-hmm. And so I was interested, so he agreed. So I did a handful of hours over the next few days while I was at that conference, and literally within a long weekend, I had about 15% recovery in my foot, and that was the first thing that changed my foot in all of that time at all. And so clearly I was interested. I actually bought a chamber just for myself. I had no intention of ever using it as a tool in my clinic at the time, but I used it for myself. It took a couple months, but at that point I had full recovery of my foot. And then I started thinking, wow, why didn't I know about this? I feel like I knew a lot. I was doing a lot of therapies. This was the only thing that got that neuropathy to heal. And I was happy, obviously, that I got my foot back, but I was upset that how did I get this far in my life and nobody told me to use this thing? And, that's when I really started to, get into the research and look. And then obviously, the rest is sort of history. But
so when you looked at the research, what did you find? Like, what was the mechanism behind that healing?
This was about 14 years ago. And, while I'd say that the research is still not where we need it to be, which is part of the reason, I went back to school last year, but hoping to try to push that forward. So I'd say it's not where we want it to be now, but back then there was very little. And so I did my best to understand. That's what I did. Is there wasn't something that said, hey, for disc herniations, you should try hyperbaric. But there's definitely some great information about neuropathy, neuropathic damage, and then what hyperbaric does in terms of healing that damage. And so, just on the surface, especially let's just say in my particular case, there was injury. So there was damage to the circulation, the capillary beds. And then as that happens and the tissue starts to just bathe in inflammation, it can't heal because there's no oxygen gradient to drive oxygen into that tissue. And with the capillary beds broken, and ultimately oxygen normally, like for you and I right now, oxygen's being carried by the red blood cells. If those capillaries are broken, the red blood cells can't get through in order to deliver oxygen to the other side. And so right out of the gate, why did I feel that in the first 30 minutes of a treatment was as you super saturate the plasma, right? So now we're changing how oxygen is delivered in the body. Instead of only carrying it basically through red blood cells, using pressure, we're dissolving more oxygen into the plasma. And now the plasma becomes a reservoir for extra oxygen. And that extra oxygen is not impeded by capillary breaks or even ischemia in most cases. So we can now deliver, there's a break in a capillary, and on the other side of that, it's hypoxic. Now we're actually getting plasma to get through that damaged capillary. And now the plasma that has oxygen can deliver, oxygen to that starving tissue. So that's the first mechanism, is just hyperoxygenation through the plasma, getting oxygen to places where it couldn't get.
And why this oxygen is important? Like, why do we need to get that oxygen to that tissue, to those cells?
A couple things. One, oxygen is necessary for cells to make energy, and all of our cells need energy just to perform normal function. But in addition, when something's damaged and you need to heal, you need to be able to upregulate that oxygen so that you could upregulate energy. It takes energy to heal. So just as simple as that, you need energy to heal, and you're going to need oxygen to do that. But in addition, hyperbaric seems to stimulate a lot of growth factors. It's an anabolic therapy. So we get these platelet-derived growth factors, these brain-derived growth factors, these factors, these signaling chemicals that tell our body, hey, it's time to heal, it's time to regenerate, it's time to grow, it's time to divide our cells. And so the stimulation of those growth factors really is what stimulates a lot of the healing. After you get the hyperoxygenation, now you're getting this healing effect. You could regrow those capillaries, you could literally regrow nerve tissue, muscle tissue, collagen, all of the above from that signal.
And how long would it take for that healing to occur?
The hyperoxygenation, like the step one that I'm describing, that literally happens in the first minute, and every hour you're getting hyperoxygenated. Depending on the study that you look at, I would say that a lot of these other things like the capillary regrowth, the nerve tissue regrowth, you're looking at a minimum of 20 hours or more. Most of the research is looking at somewhere between 30 and 40 hours where you really start getting a lot of that stimulation, a lot of that growth factor. And then I'd say even beyond, there's a handful of studies more recently that are showing once you go through those signals, even when you stop doing hyperbaric, you still get an escalation of a lot of the stem cell regrowth and a lot of those chemical pathways.
Interesting. Thank you. That was a really good description.
Hey, if you like this content, please press the like button. When you do that, that helps other people find this video. And what we're trying to do is we're trying to get all the right information in the hands of all the people who need it. So please press the like button if you found this helpful. And if you really like the info and you want to make sure that you stay on top of what we are releasing every week, hit the subscribe button. You'll get notified as we send out new videos each week.
I came across conflicting information about the disc herniation and hyperbarics. Do you know anything about that? Could you share with our listeners? Does it help?
Conflicting as in?
Some people say it doesn't do anything, and others swear by it.
I've seen studies that conflict on all sides of all equations of all issues. So, I would argue that hyperbaric should be as soon as like post-stroke, as an example. If somebody is stable, I think they should be getting hyperbaric right away. And I've seen studies to say, well, it doesn't seem to help, post-stroke patients, and I'm not sure exactly why that is. A lot of the studies on hyperbaric are unfortunately, they're very small subject size. Oftentimes the study design is flawed right from the beginning. And so we see a lot of conflicting information in the research, but I'm not convinced that that's because the research is giving us a good answer or not. I think it's because these studies in many cases are flawed. And that's what we need. We need more studies, larger groups, good, proper research design so that we can actually have more of a intelligent conversation around these topics. But I have seen studies that say it doesn't help with disc herniation. In my clinic, we deal with a lot of disc herniation. We deal with a ton of neuropathy. And across the board, we see very good results when we use it.
I tend to trust clinical information. I do trust studies, of course, if they're properly designed, if they're good quality, but clinical information is gold.
It's interesting, like within the world of medicine, we've gotten away from almost saying that clinical information isn't valuable, where, I'm a clinician, I'm getting into the research because I want to contribute to the field and I want to build the base of research that we have because I recognize it's important and because I want good studies with good design. At the same time, I'm a clinician. If it works, I'm going to use it. Something I think it took them, I think 100 or 150 years after they figured out that ascorbic acid is the active ingredient in vitamin C that was helping with scurvy. Right? I'm not going to wait for the double-blind controlled randomized study on, what's the active ingredient. If I can avoid scurvy by eating some lemons and limes, I'm going to do that first and then prove it later.
And we're in the business of treating people now. Studies are important, but we can't afford to wait.
Push the field forward, definitely.
Absolutely.
And research will do that. And we can't sit here waiting for it because, what I mean.
Not only research, your passion. We met at the conferences. I always remember you by your passion for hyperbarics and just a constant desire to learn and to move the field forward. Because that's what do you think? Where do you see the field of hyperbarics in 5 years from now?
I say this a lot when we do, some of the classes and the certifications and things that we do. Depending on how you want to view hyperbaric, somewhere around 300 years, it's been tinkered with in a variety of ways. And it seems to get a little bit of traction and then people kind of forget about it. It gets a little bit of traction, people kind of forget about it. Since at least the amount of time that we've been involved, for the first 10 years, there's like a little bit of interest. It kind of like ebbs and flows. And I'd say over the last 5 years, but really in the last like 2 or 3 years, it's literally skyrocketing. The interest in it, the awareness of it, people seeing the results kind of the way I was describing, my results to be. So because of this, and because it's safe and it is this effective, and more people are now able to get their hands on it, either because, they can do home therapy or more clinics are opening. And so they're able to get their access. It seems like it's really growing faster than ever. And so I do believe that we're in the beginning, even though it's been around so long, we still are in the beginning right now. 5 years from now, I imagine that, I'm hoping that doctors across the world continue to implement it. They understand how easy it actually is to implement, how safe it is to implement, how effective it is for their patients. And then those patients who still can't get access to it for whatever reason, or who understand the benefits far beyond treating of severe conditions, right? There's a whole realm of performance and wellness, longevity, quality of life where hyperbaric fits in. And so these folks, will continue to implement home therapy. I see this literally, growing year after year, at least for the next 5, I'm sure 10 plus years. And I'm excited to be a part of it. And I'm excited to watch it.
Not only watch it, but actually move it forward, be part of the team that's developing the industry. Jason, you mentioned the role of hyperbarics in wellness, longevity. What are the effects that you're referring to?
We started using this therapy for life-threatening, literally limb and life-saving conditions, gangrene, osteonecrosis, radiation burns, thermal burns, like awful conditions that are literally in this moment, life or death. And when we introduce pressurized oxygen, it seems to be this massive shift in this patient's recovery. And if you really looked at the exact mechanisms of how and why that works, it's the same thing. When we teach a course, we say, it's approved for crush injuries. Crush injuries are, bone, ligament, muscle, nerve, multiple tissue damage, destroyed. And hyperbaric helps with that. Does it have to be a crush injury, or could it just be, a tendinitis or a mild sprain, strain, or a tear? In other words, the way that it works for these massive, awful, acute, and life-threatening conditions. It's the same way it works for these less severe, more chronic type issues. And those are the exact same mechanisms that our cells need on some regular basis, because every cell is being exposed to some toxicity, some damage. Life happens to all of us. And the process of aging, and very similar to the process of many chronic illnesses like autoimmune and other things, it's this cellular breakdown over time. And if our cells are breaking down faster than our body's able to regenerate them, we see an advanced version of aging. And when we can speed up our recovery and the regenerative process of our body and start matching the breakdown process, we have an ability to intervene with performance, with wellness, with aging in a way that we can upregulate our capacity to heal. And therefore, we can upregulate our capacity for life. And so when we use hyperbarics for very severe conditions like gangrene or osteonecrosis, we're going to 2.5 atmospheres at 100% oxygen. And in many cases, you have to. This is a severe condition. It requires an intense therapy. Likewise, as we start to use the same mechanisms, but for less severe conditions, we can probably tune down the pressure and oxygen a little bit. It doesn't have to be as aggressive because the condition isn't as severe. Likewise, if we're going to use it for performance and wellness, we could probably bring that needle down even a little more. Not as much pressure, not as much oxygen, but do it on some regular basis to continue to stimulate that growth, repair, and regeneration on an ongoing basis. And that's where I think it fits the performance and wellness space.
Now you got me curious. When you say that you can tune it down even more, are you saying even lower than 1.3 atmospheres for performance and wellness?
No, I'd say I hope to find this out. The study that we're going to start doing is to look at a lot of the mechanisms that we already know exist. And in some cases, those have been proven at 2 to 2.4. In some cases, those have been proven at 1.75. In some cases, they've been proven at 1.5 or 1.3. But I really want to take, we're taking a broad look at, blood chemistries. And we're looking at sort of, we'll call it like high pressure, moderate pressure, and what's considered mild pressure, let's say around 1.3. And, at what point, and we're going to be looking at this over long periods of time, over what period of time, over what amount of sessions, how many hours does it take to get to this? How many hours does it take to get to this? How many hours does it take to get to this? And we hope to have a much better understanding of exactly what pressure is needed for which signaling effects and exactly what length of time is required to start to show these effects. So, I hope within the next year that we actually have some of that information. There are definitely people studying under 1.3 and, they're huge fans. Here in the US, we're having a hard time even getting people to understand 1.3, let alone less than 1.3. So, 1.3 is kind of my lower end pressure that we're using right now to try to understand the range. And then I'd love to go higher and see what happens to those folks. And I'd love to go lower and see what happens there. But, that's where we're starting from.
I also like to go lower and see what happens. In Russia, they are using 1.1 and they're getting really good results. And they're arguing that the effects, at least the anti-inflammatory effects, start at 1.3 0.09 or something like that. And I also think, I don't know, what's your take on that? Some people could be fast responders, like with a supplement, some people need a higher dose, some people need a lower dose. Could it be that?
Absolutely.
And how do we determine who needs what?
One, I think something we don't really think about often or talk about much. I think it has something to do also with what pressure do you live at and what are you used to? So I think people who live at elevation are going to be more sensitive to smaller pressure changes because their red blood cell counts are going to be higher. And so lower pressure exposures are going to saturate faster that's one of my hypotheses around one of those pressures. And again, I totally agree with you. On the other hand, is you're right. Some people are sensitive where of what I would consider a moderate dose of something, and somebody has all these adverse reactions to it, versus somebody else who's taking a pretty high dose and they're barely even getting the effects. And so we definitely have individual sensitivities. And I look at oxygen, this, you've heard me speak about it. I look at oxygen like it's a nutrient. And I want to use it like it's a nutrient, because especially on the recovery, wellness, and performance side, we're taking something that we already know that exists, naturally occurring, every cell uses it. And we're basically figuring out how to up that dose a little bit so that we can get cell function to improve.
What's your current protocol for wellness? What do you prescribe?
So it really, even within that word, I would say it varies. Some people are going to be high-end athletes and they're going to have a view of how they want that to occur. And even for that person, there's an in-season version of that and an off-season version of that. And then there's someone like me, I'm very active, but I wouldn't consider myself an athlete. I just consider myself someone who likes to do whatever I want, and I don't want any consequences, and I never want to say I can't do something. So like, how do I keep myself, active like this? So it varies a lot. What I would tell you I do is, I do about an hour or two a week.
Just 2 hours a week?
Yeah, even 1 or 2 a week on a regular basis. But then about 3 or 4 times a year, I go through like a 30 to 40 hour protocol. So I'll take 6 weeks and I really ramp it up. And then I drop it off again. And so roughly like almost every quarter I go through one of those. And then in between, usually it's about an hour or two a week. If I'm traveling a lot, it's a little bit more. If I tweak something in my adventures along the way, which often I do a little bit more, but that's kind of how I view it for me, for my life.
And do you use supplemental oxygen with the chamber for yourself?
Usually, yes, but not always.
Do you time supplements with your hyperbaric treatments?
Certain ones. So sometimes we might use molecular hydrogen. And I do, when I'm using that, I'll do that about a half hour before a session. With some patients who are particularly sensitive to oxidation, we might use glutathione or other things, in which case it doesn't have to be right before, but maybe morning of, we'll do something like that. In my opinion, the overwhelming majority of supplements, there could be synergy, but I don't look at it as the timing is that important, unless it has something to do with, typically something to do with the reactive oxygen and oxidation side of it, then we do.
Do you combine hyperbarics with any other modalities in your practice?
Yeah, I mean, we do a lot of different therapies in our office. Hyperbaric and red light is one of my favorite combinations. Again, that just started with me. I think I'm always like N equals 1. I'm like, hey, this sounds interesting. I have some reasons to think this might work. And so I do something to myself to find out what happens and make sure that it's safe, of course. I've done a few interesting personal experiments using red light and oxygen from a performance standpoint. And in a lot of ways, I find if you do it right, it's almost like you're cheating. Like nobody should feel that good. So that's a great combination. But in most cases, like for patients, we're doing some type of metabolic therapy from a nutritional standpoint. We're probably doing some type of supplement program, whether that's, a gut healing program or an anti-inflammatory program or a detoxification program. So we're doing foods, we're doing supplements, we're doing light, we're doing oxygen, we're doing some sort of rehab, some sort of hands-on, so in a lot of cases, we're combining many therapies, but not that everybody gets the same routine. It really just depends on what the issues are and what they need.
So you're a clinician, you're a researcher, and you're also heavily involved with education. And that's something new, and I'm sure it's been in the works for years, but recently you came out with this amazing course. I looked at it. It's packed, absolutely packed with information. Could you tell my listeners a little bit about it?
The challenge that I saw was, if you're doing very traditional hyperbaric medicine in a traditional hyperbaric clinic, there was a singular pathway for you to get educated and certified to do hyperbaric this way. And for us that we're doing sort of, I'll just say less traditional hyperbaric for less traditional, conditions, you could do that training, but it wasn't a training that gave you the tools you needed to practice the way I was practicing or the way many of the people that I'm training now are practicing. And so it was good information. I encourage people to learn, but it wasn't helpful from a practice standpoint, the way we were doing it. And for a lot of practitioners, they weren't even invited or allowed to participate in that training because of the way they were using hyperbarics. And so here you have, I'll just say, potentially thousands, I'm sure, of people practicing hyperbaric and no source or way to get trained properly or educated or certified. And that leaves a couple of things. That leaves, I think, some holes in education, which I think is an issue. But it also leaves the field, in my opinion, less safe. And I don't want to see that the profession or the field ever have issues in terms of how we're delivering hyperbaric and how we understand hyperbaric to work. And we want to make sure that, clinics are safe and effective and patients are safe and they're getting the results that they want. And so, I saw a need for training to occur for these people who practice hyperbarics like you, like I do, like, so many of us do. And so we basically said, okay, well, here's the standard curriculum and here are all the pieces that are missing and how are we going to combine them? So we started to create this curriculum. And then I started approaching organizations that were already doing training and certification to try to find somebody who would accredit a course like this. And so we did. In the International Board of Undersea Medicine, they agreed to help us, unify the field this way. And so I took the curriculum that I had written and we matched it with their main curriculum. And again, we created another blend. And although it changes a little bit each course, this is what we've now been teaching, and it's been going great, and it's been very well received. And it's giving the opportunity for all of us who practice hyperbarics this way to get that same type of education, but geared very specifically. I mean, it's a functional medicine hyperbaric course. So for people who are applying hyperbarics in the ways that you and I do, it gives us the training and certification, more legitimizing and more unifying the field in this way.
So making a field more regulated, so to say.
I think it's very important that we self-regulate. Otherwise, as this grows, I believe that somebody can start choosing to make those decisions for us. And, as we've already seen, the way we do what we're doing, it is safe, it is effective, and it's a little bit different. So it has a different set of guidelines to follow. But it is important that everybody who's doing it, just like everyone who does hyperbarics this other way, they follow a pretty specific format. They speak the same language, they have similar protocols, they have similar guidelines. We need that exact same thing over here for us. And that's to protect us. And it's also to protect our clinics, our businesses, and of course, our patients. And so, yeah, I think unifying under that umbrella will will absolutely help the profession, move forward even faster.
So who the course is for? Who in your opinion should be taking the course?
For sure, anybody who's, starting to run hyperbarics, or even if you've been, we've had a few courses now, we're getting about 50 docs in each course. And, it runs the gamut from different healthcare professionals, either who've been doing hyperbarics for 10 or more years, but have never been certified, or someone who's about to get their equipment, but wants to be certified before they start to run it, and everybody in between. But if you're doing hyperbarics and you're treating patients, as a clinician, you should get the proper education to fully understand all of the benefits and even the few consequences, but all of it, right? We need to understand and appreciate all the different things that it can do, positive and negative, so that we can say, listen, I understand there's like any other therapy, there are potential risks and consequences. But now that I understand exactly where those lines are, I can now keep my treatments and protocols well within the boundaries, massively minimizing the very few consequences that there are. Likewise, now that I understand all the mechanisms, I can now establish protocols that are more well-rounded to really address all the issues that a patient is having. So the course does certify docs in a variety of fields, and it also certifies, if you're not going to run your own equipment, if you're going to have a technician or an operator running your equipment, it certifies the chamber operators and technicians as well.
And those who are taking the course can also learn about the protocols that you developed for specific conditions, right?
Yeah, we go through, right now, I think we have like 30 of the main non-traditional, indications that we're using hyperbaric for, and, understanding the mechanisms of why we're using it for this, and then understanding the treatment guidelines for, best practices for those.
I'm definitely taking the course because, you have to know your ABCs, and it doesn't matter how many years you've been in practice. And I'm sure there are people who've been in practice 15 years plus, and they've seen different cases. But it's, it never hurts to go back and, learn the basics, and then, stack more knowledge on top of that. And I guess every doctors, we're in this field because we love to learn. Yeah, where people can find more information about the course.
Our main website is hbotusa.com. We usually have some information, especially if there's an upcoming course, that you can find out from there. We also have a website, it's thehbotcourse.com, and that has information about a bunch of different education opportunities. We have that certification course, and then we have, like you were mentioning, I do a lot of business consulting and training for helping a hyperbaric clinic kind of get up and running and get all the, policies and procedures and different things like this in order. So, at least information about a bunch of the different courses that we offer are on the hbotcourse.com.
Jason, thank you for coming to the show. I know you're super busy. I don't even know how you found the time to do this. I really
hyperbaric.
Yeah, hyperbaric and all other stuff, right?
Exactly.
You're not just doing hyperbarics, but hyperbarics definitely helps. And here at Hyperbaric Living, we really appreciate what you do for the hyperbaric industry. You're an authority, you're moving this forward at a really fast pace. And that's what we need. And a lot of practitioners are looking up to you, and they're sending you emails, consulting with you. You're also speaking at the conferences. So yeah, you're a well-known guy. Thank you again. And
I appreciate your time. I love being here, and I love sharing the information. So maybe as the research unfolds on my end, could be a good time that we hop back on, and maybe I could fill your listeners in on what we're finding out.
Oh, I'd love to have you back. Yeah, absolutely. That's it for today, folks. Thank you for listening. If you liked the episode, please share it with a friend, and stay tuned.